So it's now our opportunity to invite Dr. Uday Gajiwala to the podium. And thank you so much, sir, for being here.
Good afternoon, and thanks for this opportunity. As compared to the other individuals and organizations, Divyajyoti Trust is still in its infancy as far as research activities is concerned. Divyajyoti Trust has a tertiary hospital with a training center and a huge outreach program. And we see about 125,000 patients every year, perform about 14,000 surgeries. But coming to the research, the hospital was established in 2011. Training center was established in 2015. The ethics committee was registered in 2017, but not much of research activities have been done. Epidemiological studies have been conducted many a times. Um, Clinical trials started from 2020 onwards. And recently, we conducted a research methodology workshop also with the help of faculty from AIMS, thanks to Dr. Praveen sir, who is sitting here. The epidemiological studies and those kind of activities, thanks to Dr. G.S. Murthy sir, we have been getting involved in these studies for many years now. So by now, we have done about 17 different epidemiological studies related to cataract, DR, teleophthalmology, spectacles, and school skinning, etc. And we have completed 13 different clinical trials by now. There are a few clinical trials going on even today. We have some 24 publications till date, but we do not have the know-how. We had one person who was trained at ICH with Dr. Praveen sir in the same batch, but he is no more working with us. So we don't have the know-how about the research activities, how to prepare a research question or write a protocol or write a manuscript for publication, etc. And we don't know the data analysis component also. We don't have a statistician. So all these activities are outsourced. We need senior level human resource for the research activities. We, as of today, do not even have a separate team to head to conduct research activities. So we are in the process of creating a separate team to conduct research activities. So we are looking for a community medicine postgraduate who can lead the research. We are trying to learn the operational research activities, and we've been recently enrolled, thanks to Seva Canada, with Prasho, and we just attended a 2 days workshop. So hopefully, in near future, we'll be able to understand operational research more, and should be able to, because there are a lot of questions that do come to our mind when we are carrying out the activities. But because we lack the capacity, we have not been able to study any of the questions that goes through our mind. So hopefully in near future, we will be able to get going with that also. So thank you so much.
Patients are involved in patients' perspectives about research.
Patient perspective, since we have not conducted so many research activities, I'm not the right person to answer that question. But yes, there are several times when we get patient feedback about some of the services, and then we try to understand where we are going wrong, and we try to improve upon ourselves. So there is a component of patient feedback that helps us improve our activities through implementation of some modification in our activity. But I don't have more experience into that.
Yes. Thank you.
One question, because the teams have conducted so many epidemiological research. Do you think it helped the teams in any manner? Because those collecting data, Did it help them or the team for future readiness or something?
Basically, we wanted some baseline data. So when we started the hospital, we conducted a RAB study, and at that time, Rohan was just finishing his MSc. So he had to conduct a study as a part of his thesis also. So that way, we conducted a baseline activity, and then maybe we'll complete 15 years next year. So maybe to understand our impact. So that was there in our mind when we started the hospital. So these things are definitely helpful. When we got involved in diabetic retinopathy project with Dr. G.S. Murthy sir, that time also we conducted a couple of studies. So that is definitely helping us shape our activities. We do have a full-time retina specialist, and we are working with diabetic retinopathy patients day in and day out. But that probably the idea came from our study, and we realized that there are many patients who will need services. Similarly, working in rural area, there are a lot of agricultural workers in the area. That's a agricultural belt. So patients come with corneal ulcers many a times. And then we start thinking that, okay, we'll need to have a cornea department. They come with ulcers in a late stage. So we keep feeling that, can we do something? So as recently talking to somebody about how about providing protective glasses to the farm workers so that they don't end up with an ulcer at all. So these things do help us in shaping our activities.
Excellent question, Sarah. Yes, Dr. Rita. We're going to have a microphone for you.
The only time we use our patients for in research activities is that because every year we have to do an audit of the system. So in that research, we use the patients as participants so that we can go with the questionnaire and ask the patients how do they feel about the hospital, the services, the waiting time, and so on and so forth. And after that, we usually have a big again dissemination to all the staff of the hospital so that to come up with how can we improve the services. That is one. Another is we have from the government of Nepal, from the Social Welfare Council, where we are affiliated with, always ask us to do the social audit of the usually in the community. So we have that is mandatory for us to do the social audit of those patients.
Sarah's nodding. She was waiting to hear something like that. Thank you. Thank you. Well, we definitely want to appreciate the previous 6 speakers that addressed their individual journeys, their institutional journeys, and now we're getting ready to look at capacity strengthening at the sector level. Dr. Schallander will be leading the charge. Oh, and for this one, we don't have slides, so we can turn off the projector. And 4 esteemed people are going to come to the stage. From the far side here is R.D. Tulsiraj, and we'll also have Matthew Burton, and we'll have Ken Bassett, and I'll take part as well. And Schallander is going to send us a few questions, and we'll be happy to hear your questions too. Thank you.